Hello, I'm Katy Legg and I was a patient at the Mineral Hospital, since maybe just over a year. I went to see my GP to do with pain and they referred me to the Mineral Hospital for some investigations. So it started off with blood tests and seeing the consultant. So that's how it started off. They have to go through all the blood tests and do quite a lot of investigations to rule things out. So I'm diagnosed now with fibromyalgia. What it means to me is that I suffer with chronic pain, so it really has affected my whole life, so I can't do the job that I used to do, and really debilitating fatigue. So, you know, today this is a good day, like I'm standing here in a lot of pain, but some days it means I can't get out of the house or I can't get up, and I think it's an incredibly hard illness to live with. So I think I must have read it on a newsletter that came through from the hospital about today, about filming. But the reason I wanted to come was because the staff they're absolutely phenomenal. Like, incredible isn't the right word for it, as a team. So I have severe and long-standing mental health problems, which it means that I'm not only dealing with my fibromyalgia, it's really affecting my life because I have to balance the two things together. So things that are good for depression, like getting out of the house and trying to be active and when you can, my fibromyalgia in my eyes sort of gets in the way of that. And actually you've got the mental health teams often encouraging you around your depression, how to manage that. But at the same time, on the other side, you've got the fibromyalgia team teaching you about pacing and what you can do for yourself to help manage it. So the team are there, the Mineral Hospital team. They mean so much for me, for my well-being, because they really can hold the fact that, for me specifically with my mental health and life events that are going on. I did have an incident with a consultant. No, he wasn't a consultant. I think he was a registrar. So I think he was training, and yeah, I had that particular appointment was very stressful because I didn't feel at all supported or heard, and he handed over an X-ray thing, didn't explain what was going on, and but because I'd already built up that relationship at the hospital, I was able to go and actually say, that doesn't feel right, that this isn't actually how you work as a team. It was incredible, going through the PALS system first of all, so through the RUH, and then they referred it back over to the manager at the Mineral Hospital, and they dealt with it amazingly. And I really hope for that doctor too, who was, going on with his career, that he got that feedback, and that it would improve it for him. And I feel so understood by them there. I mean, the other thing is that I have spent quite a lot of time I'm a scientist myself, and I do some research into health sciences, but I really wanted to nominate them for an award, because as a patient that has real complex stuff going on in their lives, a team like this it's just, what's that word, when you couldn't ever give it a weight of money or
invaluable?
How much? Invaluable, that's the word. So I have spent quite a long time trying to find an award. So I have found the best award that I want to nominate them for, so I'm not going to tell you what it is. I feel like standing here, I am also representing other patients that perhaps one wouldn't feel comfortable to be filmed, or, it's incredibly hard having rheumatology conditions because it means we can't leave the house, or it makes you very tired, and obviously there's so many illnesses so I'm also saying this, I hope, for the patients that would want to stand here and say, that they've had that caring experience. It's all the way down to the receptionists or the nurses. They're really, really caring.